Hello, welcome back to my channel. Welcome to Parenting with Kelly. My name is Kelly Velasco. I am a mother, a wife, and a future educator. And today we're going to be talking about baby-led weaning versus traditional feeding. So this is a topic that I'm so excited for. I've been wanting to talk about baby-led weaning versus traditional feeding since before I even started my whole YouTube channel. And the reason for that is because baby-led weaning is such a new and trendy way to go ahead and introduce solid foods to your baby. And it could be beneficial. So I'm going to go ahead and provide you with the resources and just some more information on it and let you make up your mind on if baby-led weaning is for you or if you want to stick to traditional feeding. Now, before I get into the specifics, I just want to go ahead and clarify that I'm not a doctor, I'm not a pediatrician. I have no nutritional experience with this whatsoever. All I have is my own personal experience and the research that I've done. So please, if you're going to go ahead and do either of these methods, make sure you do your own research behind it. Talk to your pediatrician before you introduce any solids to your baby, just to make sure your baby is ready for solids, and just kind of form your own opinion on this. So I'm just informing you. Don't take this as me telling you this is the way to do it, okay? I think for starters, we need to start with the definition of weaning. So weaning is the process of eliminating breast milk or formula and introducing solid foods. Now, typically this happens depending on what method you choose, and it happens at different ages, which I will get into later. So traditional baby food was introduced in 1867, so that was a very long time ago. And the history behind it, which I think most people don't know, but is quite interesting, is around this time is when the Great Depression happened, and so a lot of mothers were losing their milk supply. So they decided to go ahead and mash and puree baby food to go ahead and give their infants that as a way to fulfill them, since their breast milk wasn't meeting the demand of a baby. So really, traditional feeding just happened because of the situation we were in. A lot of mothers weren't producing any milk at that time, so that's why the introduction of baby food was created. Baby-led weaning, however, was only started in 2005. Now, I'm sure other people have done baby-led weaning, but it wasn't really studied and well known until 2005, which really wasn't that long ago. Since baby-led weaning is so new, there's really not a whole lot of evidence and research behind it to back it up, and that is why most pediatricians do not recommend this, and I will go ahead and get into that later. Baby-led weaning is not even acknowledged in the WHO, which is the World Health Organization, because it is so little research and there's not a lot of evidence to back it up. Now, the reason that a lot of pediatricians don't recommend baby-led weaning isn't because they don't believe in it. It's just because there's not a lot of resources and a lot of facts to back it up. So mostly it's for liability reasons, that the doctors don't want to be in trouble if something happens to your baby, if you're doing it improperly. And just traditional feeding, there's a lot more research and more control over it, so doctors feel more comfortable recommending you to do traditional weaning instead. This is why I recommend you talk to your pediatrician before introducing anything, whether it's baby-led weaning or traditional weaning. Talk to your child's pediatrician first and see what they recommend for your child. Okay, so now we're going to talk about how it works. I think traditional weaning is pretty self-explanatory. We all know what this is. This is more than likely how we were raised. But what this method is about is you provide the baby with purees or some sort of mashed baby food, and you spoon feed it to the baby, and the baby just swallows it and gets full off of that. So there's not really a lot to it. It's pretty simple and self-explanatory. Baby-led weaning, however, is a lot more complex. There's a lot more steps and a lot more process to it. So I'm going to go ahead and talk about that process right now. Baby-led weaning is not recommended to start until 6 months of age. Now, that's very different than traditional feeding. So in traditional feeding, you could start at 4 months. You might hear to give your baby rice cereal or oatmeal, something along those lines around 4 months, and then go ahead and increase it as they get older. Baby-led weaning is completely different in that aspect. The reason that you don't introduce solid foods if you're doing baby-led weaning until 6 months is because the baby's gut is actually not fully developed until 6 months old. So if you're introducing solid foods, it actually could disrupt their digestive system and cause them more health issues later on. I should also add that 6 months is 6 months adjusted age. So that's not if your baby was born a month early, you're gonna have to wait until your baby's 7 months, just so their digestive system and their gut has the full capacity to grow. So go ahead and use your child's adjusted age if you're gonna go off of baby-led weaning. So what is baby-led weaning? The idea of baby-led weaning is that your child starts eating solid foods right at 6 months, and your child's eating what you're eating. Now, I know that sounds crazy, and I'll get into more detail about that because it's a lot of specifics and it's a lot more complex. So does this mean that your 6-month-old baby is eating steak or chicken just like you are? Yes. Is the food mashed? No. So that's the main difference, is that none of the food is mashed except for if you're eating the food mashed. So if the food comes mashed, like mashed potatoes or avocado or banana, if it's already a mashed material, then that's fine to give the baby. However, if it is not mashed, you are not doing any modifications to it whatsoever, unless it's specific choking hazard foods, which I will talk about later. So how can a baby eat regular food that we eat without choking, right? In baby-led weaning, you give your child the same thing you're eating. However, it is cut appropriately, and if done correctly, it will not result in choking. So now how do you cut the food? You cut the food in finger-length strips. So if you hold out your index finger, your food's gonna be just as long as your finger and the same thickness as your finger. So what's the purpose behind that? Most people assume that if you're giving your baby solid foods, you want to cut it really, really, really small so it reduces the choking hazard, right? Well, that actually makes it really difficult for babies to eat, and it's going to make them more frustrated and not interested in eating. Now, babies' fine motor skills are not fully developed at this age, so they're unable to pick up material that's really, really small. So the reason we're cutting it really long as our finger, is because it's allowing the child success in picking up the item. Now, why did we make it the same thickness as our finger? The reason for that is because it's actually smaller than a baby's airway. So even if the child was able to go ahead and bite off a piece of meat or whatever it is, they're going to go ahead and swallow it. They're not going to choke on it. It's not going to block their airways, as long as it's done correctly. And I need to keep emphasizing that, is if it's done correctly. Now, is that to say your baby would never choke? No. And there's actually choking involved if you do purees as well. So there's pros and cons to both, which I will get into later, but that's the main short condensed version of baby-led weaning, is you provide your child with the food that you're eating as a family, and everything is cut finger length size. So now we're going to talk about the number one question. How does a baby not choke, right? This is the number one worry, and if you were watching my old video where I talked about parent pushback, this is where you're going to go ahead and get a lot of pushback from family if you do baby-led weaning, is because they're going to say the baby's going to choke. Now, first, we need to go ahead and clear the air. What is choking and what is gagging? Because there's two main differences between those two, yet they're always interlinked. Most people think that if they're gagging, they're choking, and if they're choking, they're gagging. That is not correct. Gagging is when you hear the baby trying to clear their airway. So if you hear a coughing noise, the baby is gagging, the baby is not choking, and that is a good thing. If you can hear them trying to get the item out of their mouth, that means that their body's doing what they're supposed to, and they're still able to breathe. Choking, however, is completely different. Choking is when an object is completely blocking the airway and the child cannot make any sound whatsoever. So if you see your child with their mouth open and not making any noise, kind of like, that means that they're choking because they can't get any air up or down. I think that that's the biggest misconception when it comes to baby-led weaning and just feeding in general, is that babies are choking when they're really not. They're just gagging, and that's exactly what they're supposed to do. You want their body to go ahead and try to get the item out, and that's exactly what they're trying to do when they're gagging. The main reason that baby-led weaning was created was because of this gagging reflex. So before babies are 1 year old, their gag reflex is actually different. So all of our gag reflexes are in the back of our mouth, and once something gets back there, that's when we start gagging. Babies, however, are different. In the beginning, their gag reflexes are in the front of their mouth. Because of this, the idea was created with baby-led weaning that you want to go ahead and teach them how to chew when the gagging reflex is in the front, because that way they're going to go ahead and adjust the food first before it goes to their throat to reduce the choking hazard, is the idea. The other main difference between traditional feeding and baby-led weaning is how you're teaching your child how to eat. So in traditional feeding, it's always a puree, and you're going ahead and giving your child the food and they're swallowing it. Just like if we were to drink a milkshake or a smoothie or have mashed potatoes, there's very little chewing involved. However, baby-led weaning is the complete opposite. The whole point of it is to teach a child to chew before they swallow, so that way they can go ahead and not choke in the future. Now, if you give a baby, let's say a 6-month-old, a piece of meat that's my finger width apart, they're probably not going to be able to break off a piece because they don't have all of their teeth. That's just how it's going to be. So what they're going to do is they're going to have it in their hand and they're going to chew on it and kind of get the chewing motion down. If they do break off a piece, then they would swallow it and it would completely be capable of swallowing. So that's what baby-led weaning is about, is introducing chewing first, then swallowing. So there's actually a study that was done, and I'll link the article down below, where they did a study of 100 kids, and they had half of them do traditional and half of them do baby-led weaning to see if there was an increase of choking in baby-led weaning, since that's what most people assume. However, the results showed that there is actually no increase in it if it's done correctly. The article did say that there was more incidences of parents reporting choking when really their child was just gagging. So that's where the common misconception comes from. Baby-led weaning was also looked into by the APA, which is the American Pediatric Associations, and they also reported that there is no increase of choking if baby-led weaning is done correctly. So that's kind of just like the really tip base of baby-led weaning. Like I said, traditional feeding is really self-explanatory, so there's not too much for me to say about that. But there's a lot more in-depth things before you do baby-led weaning that I recommend you to look at. I will link some articles down below. I will link some YouTube videos, and I'll actually link a really good Facebook group that you can join if you're interested in it. Because again, there's several requirements your child has to do before you start baby-led weaning, such as be 6 months adjusted age. And there's a bunch of other readiness, like your baby must be able to sit up on their own. And the reason for this is that if your baby's unable to sit up on your own, I believe it's for a minute, don't quote me on that, but I believe it's for about a minute or 30 seconds. If your child's not able to sit up on their own, then they're leaned back, and there's actually more of a risk for choking. So you want your child to be sitting up straight. So again, go ahead and do your additional research besides just me. If you want me to give you more information, I'm more than happy to do that for you. Like I said, this topic is something that I'm really, really interested in. So I will do that for you if you want me to. But now let's go ahead and take a look at the pros and cons to baby-led weaning versus traditional feeding, because this is something you're gonna want to take into consideration before you make up your mind on what's best for you and your child. So let's go ahead and start with the pros of baby-led weaning. The first pro of it is you're allowing your child to self-pace, which means you're allowing your child to be in control of their own body and what they put into their body. In baby-led weaning, there is no spoon feeding, there is no coaching or trying to have your child eat more. You simply place the food in front of them, they eat what they choose, and that's kind of how it goes. So allowing your child to self-pace actually reduces the chance of obesity later on in the future. Another pro to baby-led weaning is that your child is allowed to be more independent. They're able to choose which item they want to eat. They're more likely to use utensils. For example, my son, spoiler alert, we did baby-led weaning with my son, and I'll make a video on that with my next week's video. But my son is 15 months old, and he can use his utensils pretty decently, and I feel like it's because we did baby-led weaning that he's able to use his utensils properly. Another plus of baby-led weaning is there is no spoon feeding with this. So there actually was reported in the study that I'll have linked down below that there was fewer mother anxiety, and mothers were able to enjoy meals because they were not having to worry about feeding their child. They were actually eating with their child. And as a busy parent, we all know that it's hard for us to eat, especially if we have to make sure our child's eating and feed our child during that time. It just makes it more complicated. So with baby-led weaning, you eat as a family, and you as a parent actually get an opportunity to eat as well. Another pro of baby-led weaning is there's that family shared bond. If your family is really big on the importance of sharing experiences and sharing meals, you can actually do this really early because you're all sitting down eating as a family. This is another specific requirement of baby-led weaning, is the child needs to have a model. I went over modeling in my last video, but modeling is just the idea of you're doing it with the child so the child knows what to do. They're looking at you as giving directions on what to do. So you're not forcing the child to eat, you're eating with the child so the child can see what they need to do and figure it out for themselves. A huge pro of baby-led weaning is that this allows a child to use all of their senses. They're using their sense of touch by feeling the food, the smell of smelling the food, their sense of sight by seeing the food and seeing you eat the food as well. So they're using all of their senses when they do baby-led weaning. The last pro that I came up with to baby-led weaning is there is an increased amount of oral and fine motor skills being used when they do baby-led weaning. As I mentioned, if it's a piece that your child's able to pick up, they're going to be able to do it themselves, and they're practicing their fine motor skills, which is called their pincer grip. They're going to go ahead and master that a lot quicker than if they did traditional feeding. Now the cons of baby-led weaning, because of course there's cons to everything, right? So the main con is that there is research that shows that typically there is lower iron in babies that have baby-led weaning. The reason for this is because your child's eating what you're eating. Food that you're eating doesn't have all of the iron that your baby actually needs. So you may have to add an iron supplement for your child just to make sure your child's meeting their iron needs. Another con is that not everybody can feed your child. So as I mentioned, we did baby-led weaning with my son, and I didn't feel comfortable with anybody besides me or my husband giving my son food, just because I didn't know if they were going to cut it properly, if they were going to model it correctly, or if they knew what to do in case there is a choking incident. I feel like the biggest con to baby-led weaning is that there's none of that cue interaction with the airplane. So we all know what that is, where the food's on the spoon and you say, open your mouth, here comes the airplane. There's none of that because you're allowing your child to do it. So you don't have that bonding experience that you would typically have with traditional feeding. Another con to baby-led weaning is that you can't control how much your child eats. So if your child's traditional feeding, most of the time they finish a jar because you're serving them the jar and you're going at your pace and you're making sure the child eats enough or what you think is enough. In baby-led weaning, that is not the case. You're just letting your child pick and choose what they want to eat. If they don't want to eat anything, you don't force anything, you just let it be. There was research done on this, and there is no correlation between lower growth rate if they do baby-led weaning. However, this is something to be aware of, that your child probably won't be eating as much as if they did traditional feeding. The last and major con that I have of baby-led weaning is it is messy. And I mean messy, especially in the beginning, because your child is in control of what they eat. It gets all over their face, it gets all over their shirt, it gets all over the floor, it gets everywhere. So just if you're taking this approach, be aware of the mess. If you have a dog, it's fantastic. My dog loved that we did this because she was able to have all of his scraps and just kind of be my cleanup area. So now we're going to go ahead and move on to the pros of traditional feeding. So the pros of traditional feeding, of course, there's pros to everything as well. So the pros to traditional feeding is that you could start way earlier. As I mentioned, they may recommend you doing oatmeal or rice cereal around 4 months old, but if you're doing baby-led weaning, it's not recommended to start till 6 months old. Now, I know, especially for me, my son was not a great sleeper, and everybody recommended us doing oatmeal to help him sleep through the night. However, I knew that we wanted to do baby-led weaning, so I held off until 6 months old. Although if I would have done that, there's a chance he could have slept longer, but there's also a chance I wouldn't have done much. So that is the biggest pro, is that you could start earlier. Another big pro is that you could feed anywhere and you can have anybody do it. All you have to do is take your jar and your spoon with you, and then you can go ahead and feed your baby wherever you're at. You don't have to worry about cutting it properly. You don't have to worry about if somebody knows how to do it, because most people know how to spoon feed a baby. Another pro is that it is quicker. So it is quicker because we are in control of how much we're giving our baby, so we can actually speed it up, we can slow it down, and it's easier for them to swallow because all they have to do is swallow it. There's no chewing involved. They just swallow it, then they move on to the next bite. I think the biggest pro to traditional feeding is that there is no mess or minimal mess. There's still a mess on the baby's face, but it's very minimal of a mess, and you can kind of control how much the child is eating or where it's ending up. The last pro to traditional feeding over baby-led weaning is that there's more research behind it. So a lot of people feel more comfortable because there's a lot more research. The pediatricians recommend it, so they feel more comfortable doing that. And I think as a parent, it's good to feel comfortable in our choices that we make. On to the cons of traditional feeding. So the biggest con of traditional feeding is there's actually an increased risk of obesity, and that's going to be linked in the article down below. So I apologize if there was kind of a change of clip or change of lightness or anything like that. My son actually woke up, so I had to go check on him, but mom duty calls, right? So as I was mentioning, there is an increased chance of obesity, and as we went over, the reason for this is because when we are doing traditional feeding, we are in control of how much our child eats. We may actually be giving our child more than they are actually hungry for and force feeding them in a sense. So that is why obesity is more closely linked to traditional feeding than baby-led weaning. Another important con to traditional feeding is that you're missing that sensitive period for the gag reflex to be in the front of their mouth. So most people that do traditional feeding, they stay with purees up until about 1, I believe, and then that's when they start introducing more solids. However, at that point, the gag reflex, as I mentioned, is moved to the back of their mouth, so that's when there can actually be an increased chance of choking. And that's not to say that if you do traditional feeding, your child's gonna choke. As I previously mentioned, there's really no higher chance with either method. So that's completely up to you, whichever method you feel more comfortable with. Another con is that there tends to be more food and texture aversions later on if you're introducing solids at a later age. And that's because the child is used to one form of texture. So once you start adding more textures, they may not be familiar with it and they may not like it as much. The last major con that I could come up with is that there is more prep time in traditional feeding. So you're having to puree foods. This is specifically if you're making your own baby food. You're having to puree your own foods, and you're having to put them in jars and spoon feed your child. So it just takes more time altogether. Now, one thing that made me not choose to do traditional feeding and wait until 6 months old to introduce something is because it's not recommended to mix these together. The reason for this is because, as I mentioned, with traditional feeding, you're just teaching your child how to swallow. By introducing traditional food and having your child just swallow, 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 when you introduce solid foods, your child might actually just try to naturally swallow the food without chewing it. So that could be an increased choking hazard. Now, that's not to say if your child is 4 or 5 months old and you've already started purees, can you not start baby-led weaning? No, of course not. You could definitely do that if that's the choice that you want to do. However, it is recommended to give your child a 2-week weaning period of not having any sort of purees whatsoever, so your child actually loses that skill of swallowing, and then you can reintroduce solid foods and they'll learn to go ahead and chew before they swallow. As I mentioned, baby-led weaning is a lot more complex and there's a lot more steps to it to do it correctly. So it is important that if this is the method you think is right for you and your family, then it is important that you do additional research to go ahead and better inform yourself and make sure that you're taking care of all those little kinks before you get started. I feel like I could talk about this for a very long time, and if you have any more questions, go ahead and leave them down below and I'll go ahead and respond to your comment to the best that I can. And if I need to make another video on top of this, that's totally fine as well. Like I said, I really love doing this just because this is a new way of possibly introducing solids to your child. I definitely see the pros and cons to both baby-led weaning and traditional feeding. I'm not 100% pro either. I think that as a parent, it's up to you to make the choice what's best for you and your child. And if you think that baby-led weaning is going to be better for you guys, great. If you think traditional feeding is better for you guys, then that's great as well. I don't believe there's one specific way that is better for all children, because as I mentioned, all of our children are so different that we need to look at them as individuals and decide what is best for this child. So as I mentioned, I'm pregnant with another child. We'll see at that point if I feel like this child is ready for that when we get to 6 months, since we did do baby-led weaning with my son. But it's all going to be individual based, and that's up to your discretion. And as I mentioned, please, please, please talk to your pediatrician before you do either of these methods. Now, be aware, if you're going to do baby-led weaning and you talk to your pediatrician, you might have some pullback. I had pullback as well. It's just important, if you're going to go ahead and continue to do it even though your doctor advised against it, to do a lot of research on your own. And like I said, I will provide you with a lot of links down below so you can feel secure and informed. But I think that's pretty much it for today. There is a lot that goes into it. And next week, I'm going to be talking about my experience, mine and my son's experience with baby-led weaning, because we did start it at 6 months. So I'm going to go ahead and talk about what we introduced first, how many meals we did, why we chose to do it, how it turned out for us, if there was any choking or gagging going on. And I'm actually going to go ahead and show you guys how to properly cut food as well. So that's what's coming next week. I hope that you tune in for that as well. If you have any questions, comments, or anything like that, I would love to hear from you down below. Please go ahead and like, subscribe, and share this video if you thought it was informative. But until then, I will see you next week. Thanks. Bye.